So, hello everyone, and welcome to Division 46 of the American Psychological Association. We are the Society for Media, Psychology, and Technology. My name is Christian Aloma. I am the past president. My current role is past president of Division 46, and I am excited to introduce you all to today's topic and speakers. But first, a couple of housekeeping items. This presentation is being recorded and will be published to our YouTube channel shortly after the presentation is complete. If you would like to ask a question during the session, there are a couple of ways to do that. The preferred way is through the Q&A. There should be a Q&A button in the middle of bottom of your Zoom window. If you click that, that'll give you the opportunity to post a question, and you can do so either anonymously, or with your identity attached. That just helps us sort of catalog and track those questions, and then at the end of the conversation we are planning to have some time for discussion, and I'll try to make sure those questions get asked. You can also drop those questions in the chat. Sometimes a very active chat moves quickly though, so we can lose track of questions if they start really kind of filling up. So the Q&A is one of the best ways to do it, but you're welcome to use the chat as well. Overall, we do typically, depending on the speaker's preferences, sometimes edit out the discussion section at the end of the recording, so there is that sort of option there. But do know, in some cases, if you are using your name or your identity, it will be part of the recording as well when we repost that. Now, the topic of today's webinar, or before I get to the topic, I guess, one other note. This is a webinar, it's one-way recorded. You cannot turn on your microphone, so don't worry about speaking up or accidentally saying anything or washing your hands while the recording is going, things like that. None of it will be picked up. You are able, though, as mentioned, to chat with each other, and certainly we encourage you to do so, as well as to just share some of your thoughts and reactions during the session overall. I know presenting to an invisible audience to some degree can sometimes be a little bit difficult, so as you're chatting or reacting, it certainly helps our speakers feel as though they're really connecting with you all. So our topic for today is digital harm reduction in action, individual, family, and community approaches. And we're joined today by Kate Blocker, PhD, Monica Rondeau, PNP-BC, as well as our session is being moderated by Thekla Brumder Ross, PsyD. And as a quick note, Thekla is also the chair of our Digital Harm Reduction Committee here at Division 46. So a quick plug for anyone interested in learning more about this. Thekla's the person to go to within our division. So Kate Blocker is the Director of Research and Programs at Children and Screens, the Institute of Digital Media and Child Development, where she leads research and public education initiatives, including the Screen Deep podcast. She holds a PhD in experimental psychology from the University of Alabama. Joining her is Monica Rondeau, who is the Pediatric Provider Program Manager at Sanity, an international nonprofit focused on digital wellness for families. She's a board-certified pediatric nurse practitioner with more than 12 years of primary care experience. And then, of course, our moderator, Thekla Brumder Ross, is a clinical psychologist specializing in technology, addiction, and well-being, and chair of the APA's Division 46's Digital Harm Reduction Committee. She's also co-author of It Won't Love You Back, and previously led harm reduction initiatives at Kaiser Permanente. So thank you all for joining us. We're excited to hear from your experience, your wisdom, and your insights. Thekla, I will pass it off to you.
Thank you so much, Christian, and thank you to Christian and Jennifer and the team at Division 46 who make these incredible webinars possible. If you haven't gone on to check out the whole gallery of webinars, there's amazing ones from Jonathan Haidt to our Division 46 researchers and policy leaders and clinicians. So please look at those and access those. I am so excited today to join in conversation with Kate and Monica about this really important topic around digital harm reduction. And let's start there. Digital harm reduction is really about meeting people where they are. So let's talk about the definition of digital harm reduction and how it differs from simple screen time limits, as we've heard a lot about recently, and where you see, both of you see the momentum around, especially around youth and adolescents, given your areas of expertise in digital harm reduction. So Kate, we'll start with you.
Great, thanks, Thekla, and really excited to be here and join this conversation today. And, I think for children and screens, when we look at digital harm reduction, we're asking ourselves, how can we help children lead healthy lives in a digital age? And that's lofty, it's a big goal, but that exactly what you said is meeting them where they are. So we try to do this by creating supportive environments through evidence-based resources, advocating for healthier community norms around digital media use, and also promoting safer digital landscapes for children. So looking for the ways that we can help optimize the benefits of digital experiences and digital tools that are available, while limiting or reducing as much as possible the harms or risks to them. And as far as momentum, it's such a great question. There's so much, right? There's so much building and really expanding. I think we've seen a lot of momentum around awareness in the past few years, just awareness with families and with youth themselves about how these platforms are designed and what their goals are and how that compares to users' goals themselves. But I think we're starting to hopefully see some momentum as well around platform responsibility and what that might mean for changes to designs that are pushing maybe more problematic engagement patterns. So I'll stop there for now and turn it over to Monica.
Thanks, Kate. And thank you, Thekla, for having me in Division 46. Screen Sanity, nonprofit, as they mentioned, started in 2018. And our mission is also lofty, create a world in which kids are captivated by life and not by screens. So that sounds and it's changed a lot since 2018, really, and what we are talking about and what that looks like. So, but still with that mission in mind and creating tips, tools, and training for parents. And with that being said, it is defining what digital harm is important. And it's also then what do we do about it? And in that movement and what we've seen. And at Screen Sanity, we've seen a lot of movement around, also what Kate mentioned about, liability and hopefully being a bellwether case, what has happened, with Meta and that, but also the research is really showing that there's new progress and people are really coming out around the smartphones being able to be introduced in a smaller, more thoughtful way, and technology being introduced in a more thoughtful way. There's new alternatives out there. When we talk about that, that's really exciting. We found a lot of momentum around, the founders who started Screen Sanity always say there used to be no alternatives to smartphones back when they started in 2018. We've seen a lot of movement around, now there's landlines and, cameras without screens, things like that are starting to be more of this analog movement that we're seeing, the analog movement with younger generations and also that. So, also we at Screen Sanity, we talk about the tin can. We just launched a project recently that was really exciting about a whole school getting a landline telephone through tin can and what that would do as far as reducing that digital harm, trying to make alternatives so that, we're not just taking things away and saying, less technology, but here's some alternatives that you can use. And so I see a lot of momentum in that. When I think about, I'm a pediatric nurse practitioner. So when I think about reducing harm with digital safety, I think about the things that I talk to patients about some of the really strong online harms that we see about, sextortion and drugs online and things like that. But also, talking to them and encouraging them to, take media slowly and thoughtfully, even from a really young age. In pediatrics, we talk about that. And also, starting really basic with families. We talk about something called device drivers at Screen Sanity that basically says, you can always give more technology, but starting really, really basic is really important. So I see a lot of momentum in that, the basic phone. And now we're seeing, that there's a lot more alternatives out there for that. And that's really exciting, I think, momentum as far as reducing digital harm.
Yes, so well said. And I love the intention and the thoughtfulness that you noted as the momentum is shifting and changing. I have the fortune of leading youth and teen groups here with a nonprofit called Disconnect in Milwaukee. And I see a lot of intention around how do we engage with our screens from our teens and from our youth? And a lot of it is just around values clarification and how do we want to live in relationship with this technology? And Monica, I'm so glad you mentioned your partnership. Check out Tin Can if you haven't looked at it, and check out Screen Sanity. You can look at that partnership. It's a really fun way to bring sort of research to real life. So speaking of research to practice, let's give examples of some research shaping like a tool or a program or a campaign. Tin Can was a great example. What makes those tools actually usable for busy parents or for educators, Kate, or for pediatric teams, Monica, because you really work in that integrated healthcare setting?
I was going to say, With regards to that, the pediatric, so with Screen Sanity, the program that I run is called the Pediatric Provider Program. And really, since 2024, we went in and talked to pediatricians and kind of got their input on how do they talk to patients about screens and what is it that they need to be able to do that. And that was all based on a study that came out from the Journal of Adolescent Health that said that a 1 to 3 minute conversation between a pediatrician and their patient improved the way that that child interacted with technology. So with that being said, we thought, this is a great avenue to try to help pediatricians. And working in primary care, when I say 1 to 3 minutes, sometimes amongst primary care providers, they look at me like, where in the world am I going to find 1 to 3 minutes to talk about this topic? So we try to really make that something that they can do and equip them to do that in a meaningful way. But I think that research is really important. I always bring that up with these providers. I'm like, if you just have a short conversation, it can really do a lot. So I think knowing that. And then from C.S. Mott Children's Hospital, I always talk to them about this, that there's a study from 2025 that just showed the top health concerns from families, and the top 3 all were around technology. So, above even things like bullying at school and different harms that they're seeing, weight concerns, things like that, diet, exercise, all that. It was above all of those. So I'm like, we know that this is a top priority for families. We hear that it's a #1 battleground in households everywhere. And so knowing that pediatricians, so that's a study that I feel like really indicates, how we can help and how we can really do something in that field. I'll pass it over to Kate.
Sure. Yeah. Thanks, Monica. That's a really impactful study, and so glad to hear how it's informing your work. And, at Children Screens, our goal is that, all of our resources are meant to provide evidence-based guidance with the hope that all of the decisions that families are making or that educators are making are research informed, even at that granular individual family community level. And so, there's research out there that really shows the importance of active parental mediation and how that can guide digital, it improves reducing excessive use, overage on time and things of that nature, but also just developing healthier habits, healthier relationships, particularly in adolescence and beyond. And so, our goal is how do we make sure the research is really accessible, that, every situation is different, every child is different, even within a family, but every family is different. We talked about values and intentionality, and what does that structure look like? So it's can be really challenging, right, to put out these just blanket recommendations. So how do we make sure that when we do have research that comes out that says, this factor or that factor can be protective or enhance risk, that we are putting that information back into parents' hands or educators' hands in ways that are really easy to understand for them to say, okay, now I understand the foundation here of what's driving this impact or why this happens, or what types of designs might be more problematic, or what a red flag is that something's maybe starting to go wrong. And I can look at my child or my student and say, okay, this is what this needs to look like today. And tomorrow might be different, and the next child might be different. But how do we make sure that information is there? Because it's also complicated. Being a human is complicated. Development is doubly complicated. So how do we just, normalize that critical thinking and decision making based on the research that's there by making it really accessible and putting it out there in bite-sized pieces as much as we can.
Oh, so well said. I had the fortune of leading alcohol as a vital sign, similar to Monica, what you're talking about, which sounds to me like screen time is a vital sign. And we used to always tell the primary care physicians that just asking the question about alcohol is an intervention in itself. So to all the healthcare providers on the call, you're not going to have it perfect. It's not a perfect conversation. It never is about drugs and alcohol and sex. And so don't assume it's going to be about screens either. And just don't be afraid. Get into the mess of it all. And I think, as I say, all data is good data. You'll get a lot of great information. Monica and Kate's website, Screen Sanity and Children and Screens, also have incredible resources for conversations in your school community. One of the reasons I wanted to have this webinar is I took a Screen Sanity playbook around how to have a conversation with parents in my own school community at a Milwaukee public school, took that information and was able to facilitate a conversation with other parents around the messiness of screens and schools and families and everybody with different values from different spiritual backgrounds and community backgrounds. And how do we come together to support one another in this conversation? So a plug for both of their incredible resources on their websites and their playbooks. They're really accessible and usable. You don't have to have a PhD in order to facilitate this type of conversation. So I wanted to say that. So Thank you so much, both of you. And I also want to say that both of your organizations are doing a great job of bringing in the newest evidence-based research as it's coming online. And so I want you folks on the phone to know you can look to them for that kind of data and feedback as it's coming in, because we know it's all coming in minute by minute. Okay, let's talk about family strategies. I am a mom of a 10-year-old and a 7-year-old, and as Kate just said, it changes, it differs. It differs how old they are, when they are, where we are moving through society and cultural norms around this conversation as they're growing up. We are currently reading The Amazing Generation, myself and my 2 kids. It's really fun. There are a lot of great conversations. There's a lot of excitement around it and talk afterwards, and sometimes resistance about it. So it's not all perfect, and that's okay. That's okay. All of it's welcome. So what are some family strategies? What are some shame-free ways for struggling caregivers, for struggling educators, moving beyond sort of rules toward routines and rituals that protect attention and sleep and relationships, all the really important things that we know sustain us as human beings and help raise our children in healthy developmental ways?
Happy to jump in and just, I think, build off of the example that you were just setting, Thekla, which is just conversation and dialogue. If you're not sure where to start there. And that might be with your child, that might be with your partner, that might be with other parents in your community, wherever you're maybe feeling that tension, and just start asking questions. If you're not sure where to start, ask your child what they do online and why they enjoy, what do they enjoy about it and why. And just learn more, because I think that's a lot of the overwhelm for parents, is just not even being able to keep up, right? It changes every day, and youth are living in a completely different online space than many of us adults are, and so just being curious, judgment-free, open conversations. I mentioned the research into what we call active parental mediation. And the core of that strategy is that conversation, just constantly facilitating, because that's what opens the doors to finding out what's working, what's not working, to helping model problem solving and critical thinking. And all of that evolves if we start by just trying to build those safe, open, consistent spaces for communication, hopefully early, right before they even have technology, but it's never too late to start. And the one sort of additional recommendation I want to throw in there is make it as risk-free, stress-free as you can. So while you're doing, especially with teens, while you're doing some other activity that you both enjoy, maybe while you're riding home in the car from school, don't necessarily sit down at a dinner table like face to face and say, okay, we're going to talk about social media today, right? But how do you just approach these conversations in a way that feels just natural and curious and judgment free? And then, as much as you can, when you start to hear some things, is just receive that with that same curiosity, and try to approach it with just a partnership and collaboration as much as possible as you start to figure it out together. And to your point, Thekla, you talked about routines and guidance, and just, depending on the age of your child, some of that you may do with them, and talk about what those rules might look like, what, again, is or isn't working for them, and what boundaries can they start to develop or you can support them in, and then check back in on that, reflect on it. And again, that's all that happens through conversation. So I think that's a good starting point.
I love what you said there, Kate. And, I think too, bringing communities together at Screen Sanity, we really believe in bringing people together and creating a conversation in that community that helps parents not feel alone, because I feel like that's one of the biggest things with this is parents seem to feel isolated. And that's why, Kate, I love that you're like in bite-sized pieces. We try to do the research and give it to them in bite-sized pieces, because it's so much for us to try to figure out. So if we can take that and also to bring that community together to not feel alone is, I think, so important. In primary care, I was just talking to a provider last week, and when you were talking about, bringing parents together and having that conversation, a lot of times, even in primary care, we'll see where, a kid might be on one side of it thinking screens should be this way, and the parents, and there's really that lack of communication between them, or they feel like they're in different sides of the room, and it's like, hey, let's bring this together, because that's the only way we're really going to create any change, is when we bring that conversation together. So for providers, I love, Thekla, you said no conversation's a bad conversation, just getting it started. A lot of times in primary care, just telling people, hey, you just need to talk about this, is just, and giving them the right to do that, I think is so important. And for for what we do with parents and communities and bringing those together, I think that's important too. Just showing people that they're not alone, and there's things that can be done, that that can help. Littlest things, littlest changes can make a big change in their world. So, I think I love those points. I also think the routines at a young age is so important. In primary care, we talk about anticipatory guidance and how that, we ages and stages and all those things, and so great. But it's like, just like we talk about meals and bedtime routines at a very young age, I'm encouraging patients and providers talk about screens in the same way you talk about that. Hey, you're going to start feeding them meals. What are you doing with screens? Bedtimes and nap times and all that. So parents start thinking about it in that same routine as an actual routine that they have to figure out. I think that creating more awareness about that can be really powerful too.
So important. And when it comes to the routine conversation, we're also talking about parents, right? What is your own routine and ritual around your behaviors with technology? I was asked to lead a discussion around children and their screen use. And I said, we can't have a conversation about the one finger pointing at the kids unless we have a conversation about the three fingers pointing back at us, the adults. So I think the conversation in the pediatric setting, in the school setting, is really a familial discussion. And that was one of the emphasis of our conversation today. It's a community, it's a family, it's a group-based conversation. And as a parent, how can I model that kind of behavior? So the way that I do that, I teach self-compassion to medical students, which means I get to show up imperfectly in certain situation and model that. So I often call myself out at the dinner table, like areas and places where I maybe didn't show up well around my screen and my technology use, and model that for the kids, and then say how I want to do it differently the next day. Or when I do it well, how did it nourish me, right? When I didn't use my screen the last 30 minutes before bed and the first 30 minutes in the morning, how did I feel different physiologically? How did I interact differently with my colleagues and my friends and my coworkers? And how did that impact me? But really show up imperfectly and invite your neighbors and colleagues and friends that it's never too late. It's not inevitable. It's not like you already gave them the drug, so we can never take it away, right? This is harm reduction. Harm reduction was created and founded in a public health movement by those who were actively using drugs and alcohol in the HIV and AIDS epidemic. And they really said, how do we reduce the harm for getting infected with HIV and AIDS and hepatitis B? And how do we really use more safely? And so I think that conversation is really important when it comes to screens, right? We can't erase it all together. So how do we reduce our harm? So from a systems and collaboration perspective on that note, where are schools and health systems effectively adopting digital harm reduction? Like, where's it working, quote unquote? And what are the biggest barriers? Monica, you've mentioned some of these, but practitioners, and Kate, you've said some around educators face. And how can we really help them navigate? And I know we have a lot of clinicians on the phone, so how can we as clinicians help them navigate?
Do you want to take that first, Monica, or I can jump in either way?
I can talk about it first. Yeah. I think it's, first of all, I would say in schools, I know that there's been the landmark case, just thinking about schools huge at the administrative level. What they've done in Los Angeles is really interesting with ed tech. And we're not talking a lot about ed tech here, but I think it's worth noting, that they've made some new guidelines and are going to come out. And I've actually just connected with another group of moms in a different geographical location that's hoping to do the same thing with their school district. And if you haven't heard, they're defining really school expectations and kind of what grade specific limits are they going to be giving at those. So kind of exciting things that they're doing at that level. I think for a provider or for patients and providers and clinicians, when we're talking about that, I think, what we can do is just continue talking about it, starting really basic. I think like we've talked about with Thekla and what you've said, how important it is in just starting that conversation. And if we can do it even in, effective strategies, we can always add more technology. At Screen Sanity, we talk a lot about, device drivers ed and starting really basic and encouraging patient to put in some of those levels of friction maybe in their life where they don't have any friction is a great way to do that. So, I think as far as health administrative, like at the larger level, there's a lot of work to be done there as we're talking about policy and what they're going to do with that. But I think, just starting, if more and more providers are talking about it, then I feel like administration is going to have to catch on too at those larger levels.
Yeah, and I think, across the shared barrier, maybe that Monica has certainly touched on, right, is time and just the number of stress and additional pressures that are facing all of these groups, whether it's educators focused on testing and scores and all the pressure around that, and how can I really give up time of my day to be thinking about, technology and digital literacy, or all the promises made behind these tools that Monica, as you talk about ed tech, come to mind. And certainly clinicians are facing that. Just we've already touched on that, the time and just everything that has to be covered in such a short amount of time. And I think what that really points to is some of what we've touched on here today, is like the importance of clarity and key starting points, right? Like what one change is going to have a big impact, and that it doesn't always have to be a complete rework, but sometimes that is what it takes for clarity and simplicity. So for example, in schools, we're seeing success from school phone bans. Early research is starting to show that there are some different studies find different impacts, but across the field, we're seeing academic improvements, especially for the lowest performing students. We are starting to see some early indicators of well-being indicators starting to go up, but even more interim outcomes like improved focus in the classroom, improved attention, fewer behavioral asterisk there. Some schools first experience an increase in behavioral, but that usually comes back down after a year and settles. But in less teachers spending less time trying to moderate phone use, and specifically that the strongest outcomes seem to be, at least at this with the early evidence that we have, coming from the full day bans. And I think there's a lot out there to interpret from this, but at least from teacher reports, one of the things that seems to be rising up is the ease with which they are able to enforce that, the clarity that something like that brings, whether that's across the state and all schools having to follow the same policy, or within a school district, but being able to say, this is the policy, as opposed to policies where teachers are sort of stuck deciding, okay, well, here's how I'm going to treat it in my classroom, and then having to deal with reminding students of what the different rules are, and also being that sort of behavioral management. So I think where we can find these paths towards clarity can really help, streamline in how we implement these strategies. And that's so often, I think, something that we need to do better at studying as well, is like not just what is the policy and what is the outcome, but what is the implementation in between and how that might impact things. But when we are so strapped for time and so many other things on our plates, I think that whatever can be sort of the clearest guidance just helps standardize that and normalize that across the board. And then when we're talking about, community, right, then we can see that sort of building up as well.
So well said. And we can learn. I mean, I love your plug for dissemination, implementation, and sustainability science. That's the heart of my career. So it touches my soul. But it's really about what we can learn from each other in our community-based implementation, and what works and what doesn't. And that's how we learn. So I'm going to give an example of that. In our public school community, we have found that digital literacy and screen conversations, not ironically, drawing from other public health initiatives, are best often discussed in the library with the librarian. And it's not another thing for the teacher to discuss. It's not outside of the classroom. Of course, it bleeds into the classroom. Where does it bleed in? In the mental health conversations, in the anxiety conversations with the school counselor. We can't have a conversation about mental health, substance use disorder, anxiety without talking about screens now. And so it's another example of, in this implementation strategy, the librarian, similar to other harm reduction initiatives that we know, librarians often carry naloxone, right? So thinking about places and spaces, there we go, where we can really lean on what's happening in implementation on the ground and study that and then translate that to other areas. You said something, Monica, that I hope other people heard, because I heard it and it caught me right away. You said device drivers ed. So I'd love to pin back on that. And then I also just want to say that, Kate, you brought up something that is not just happening in the school system conversation, but it's also happening in the workplace. I do some speaking and engaging with HR departments, and they're having a similar conversation around not full day bans, but sort of how you're engaging with your device throughout the workday. And often they refer to it as no smoking between meetings, like no smoke breaks between classes, right? So the full day ban, as we think about that, it's sort of in the no smoking between classes genre. So just getting people thinking about that. But Monica, before we move on to the next, can you just talk a little bit about device drivers ed, please?
Yeah, thank you for bringing it back up. Device driver's ed is a way that at Screen Sanity we talk to our families about talking about how to introduce phones, and the thought that, almost everyone has learned how to drive or taught someone how to drive or went through that process, and that really starting really basic. You wouldn't give this 16-year-old the keys to the car without having instructed them and taken it very incrementally. So gradually building more responsibility at each stage as you show competence. So, if you want to start with a basic phone, we actually have a roadmap that we map out that talks about like a basic phone or even a walkie-talkie as being a first device for children to learn how to use, and then gradually working up through watches, smartwatches, and then phones, basic phones, and then finally a phone that has full capability with all the apps and bells and whistles, and that's showing full responsibility, knowing they may still have bumps and bruises. We always say there may still be accidents along the way, which there likely will be, but they will have been prepared at each step to gradually go through each step, and you're coaching them along the way, often from the driver's seat. We talk about parents really being the coach in that, and that at each step, encouraging that child, whatever they come across, that we can talk about it and work through it. And then they show confidence, then we move on. So that's the idea behind device drivers ed. Providers have told me time and time again when I talk to them about this concept that they feel like that's an easy way to talk to patients about that, because it's something everybody understands conceptually, so they can apply that to technology in their own home using that same concept. So that's been useful. So thank you for bringing it back up.
Oh, I love that image. I'm actually imagining myself in the driver's ed car with my teacher. I can visualize her now, and how important it would have been in that adolescent time frame to have a screen conversation with those random students from other schools in a car, talking about screens. So what
now we just need that driver on board, except for on our phone.
Yes,
right?
Screen on board.
Yes,
Right.
Right.
That would actually be advantageous for all of us stopping behind each other. Screen in use, maybe, is what that bumper sticker needs to say. I just want to compliment you both, because one of the things I think that we do sometimes well in our field and other times not so much is that you two right away, when I brought this conversation up, thought about ways to collaborate and ways that we can come together. And I think that that's what this movement requires. It requires policy leaders and clinicians and educators and government officials and product designers and family advocates to all work together in collaboration and really think about who needs to be at the table. You heard me say at the beginning that I have the fortune of leading digital harm reduction groups with youth and teens. They need to be at the table in this conversation, right? This can't be a top down, this has to be a bottom up. So who needs to be at the table? Where are there collaboration opportunities between Children and Screens and Screen Sanity and others? As we really think about, it's not just the individual, but the family, the system, the community, the government, the cultural level of this conversation.
Thekla, I think you just summed it up all so nicely in that, right? Which is just this: children live within these ecosystems, right? Like you start with the individual and the family, and everything is interacting with each other. And so changes at any single one of these points, right, can have an effect, but can have such bigger effects if all of the changes are happening, right? If we have families making more informed decisions and communities having better overall norms and designs, industry regulation that's designing safer platforms for children. And I think, the any of the ways that we can bring all of these perspectives to the table, and I think at risk of being too ambitious, I don't know that there is a sector that shouldn't be at the table when it comes to digital harm reduction specifically for children, right? Like there's every piece of this is gonna matter, especially as we talk about, I love that you brought up the workplace, and some people may say, well, what does that have to do with this? But it does, because you've already pointed out the parent use, right? And where is the parent bringing their own relationship or digital media stress into their interactions around their child, and their workplace and their cultures around that are a huge part of that. And so I do think it really does require, a society-wide reframe on these tools and what they mean in our lives, and how, how we want to show up around them. And I think, the next frontier is upon us, of course, right? We have social media, we have smartphones, but of course we're looking to AI. And so I know, Monica, it's a great opportunity for us to start maybe getting ahead. It's moving so fast, we're already too late to maybe get ahead, but where we can start to collaborate around some improving systems there, for sure.
I love that, Kate. And I think, yeah, I mean, I second everything that Thekla, you said. And Kate, I think the more organizations at every level that we have, the more momentum we will have in this movement towards, reducing digital harm and figuring out what digital health really means and how we find that. I do think AI, I know Kate and I, brought that up, it is upon us and we've already experienced it in so many ways, but I feel like there's so much to learn and to know about how we educate families and communities about AI. I feel like right now I'm just, in the education that I do, trying to explain all the ways that we encounter it in our world, and just understanding that. I think there's a lack of understanding. So I would love to, Children in Screens does such a great job with all the research and help guiding our research as we educate families. That would be what I would love to collaborate with Children in Screens on. And also, like I said, just the more organizations, I feel like the more and more you hear about this and the movements happening and the organizations forming, the more momentum we're getting. So that's all great things and positive, and trying to be full of hope in this field as we continue, to battle.
Yes. And just to double click on a few of the points you both just made around the research. I mean, Kate, you mentioned, the behavior at work impacting the behavior at home. And we've actually seen from the research that folks who are actively doing electronic medical work at home during the home time, it actually negatively impacts work behavior, burnout. And so that's dribbling into both home and work life, right? Even though that's been culturally normed. And again, not pointing the finger at the provider, because that's a system level issue that we haven't created enough time and space within the workday to actually complete the work at work. And thus it bleeds into the home. But just, double clicking on that. And something we talked about earlier that I also just want to state the research on, which is teens especially want to be asked about their screen use. They know it impacts their health and their behavior. We've seen this from Children's Hospital Boston research. The same is true about alcohol and other drugs. People know that alcohol use impacts their behavior. They want their providers to ask about it because they know it's an important part of their health and overall well-being. So for any of the folks who are clinicians on the call, therapists on the call, folks want to be asked, even if the conversation is imperfect and messy and, not stitched, and we have a perfect plan, because we don't have perfect plans right now in terms of treatment plans and evidence-based treatment plans. But people want to be asked. They know it's impacting their behavior, mood, sleep, all of it, relationships. All right, we're going to get into a little hope, because we like to end on a positive note here before we get into questions. So if you haven't put your questions in the Q&A, please do so. Before we get there, what gives you both hope in the next 3 to 5 years, and one action you'd maybe love the attendees on the phone to take with them from our conversation today?
I can start there. I feel like for me, I feel hopeful when I look at the communities that I get to do this and talk with, parents out there, coming to these presentations, wanting to learn more, providers, pediatric providers in the space that I run my program in, wanting to know how to help. I feel like there's a lot of people out there that just don't know how to start the conversation or begin that. So when I'm able to talk with them and we're able to educate, parents often, leave our parent night, which is a program that we run that brings communities together. They leave that and they say, man, I really wish I would have invited my friend to come. I wish more people, so that gives me hope, when people are learning about this and understanding the harms that are out there and that they face and their children face, and they're wanting to learn more or to engage more, or bring that information to their community. That really it gives me a lot of hope in what I see in the practicing that I do. And I'll say with that, I think, if there's anything to take away, I feel like just one simple step. We often talk about those levels of friction. And I actually just heard Jonathan Haidt talking about this too. And Thekla, you mentioned this earlier too, that he said he tells his students to look at 5 minutes or the 30 minutes before bed and the 30 minutes they first wake up, and make a list of the 5 things they do, and whatever those are, kind of thinking about are those the things they want to be doing before bed and right before bed and when they first wake up in the morning. But adding those levels of friction, whether it's, I don't know if anybody knows, you can turn your phone to like grayscale with a few like activations in your settings. Looking at a screen that has no color is a lot less exciting than looking at a screen with grayscale. And so things like that, deleting apps, spring cleaning our phones a little bit, deleting notifications out, just those little steps that might create a little more friction. There's some devices out there that physically require you to like lock your phone, and you have to physically unlock it with something. So those devices like that are great. So just thinking about a way to create some of that friction in your life, and then inviting a friend or two to do it with you, I think creates that little community, and then also creates a little ecosystem within itself to spread digital wellness. So that's what I'll say. As far as lots of hope moving forward, I feel like there is hope, and that we will find what that is, and just those little tips to maybe think about doing something for yourself at home.
That was all great. Thanks, Monica. I love the hope around community. We are seeing so many communities step up and say, okay, what do we need to do to help the families in our whole community start to treat this better, which is so inspiring. I also get a lot of hope from the next generation. I mean, they are thinking so critically about this. They, like you said, Thekla, like they really want to be asked. They really want to, because they want to talk about their experiences and what they want from it, what they want to see. And there are so many incredible youth-led organizations nationally that are really stepping right into the mix. And Design It For Us, No Social Media November, Rethink, Young People's Alliance. There's so many just incredible groups, but also just youth everywhere, just everyday youth who aren't necessarily running national organizations, but are still stepping into their schools, stepping into their friend groups and saying, we want to do this better. Let's do it together, and I think, like you said, Thekla, like they need to be part of the conversation and at the table, because it's not only because it affects them, but because they have so much to bring to that conversation in terms of ideas and what this could look like, should look like. And so I just have a lot of hope for what that will mean for the next few years, both in, as they become parents themselves, but as they step into businesses, as they step into tech design, as they step into being doctors, that they're going to be carrying that experience that they've had and their critical approaches to it in really meaningful ways, and looking forward to seeing what that means. For sort of a one takeaway for me, and really for us at Children and Screens, we like to recenter relationships and just the interaction, whether that's parent and child, friends, partners, whatever that relationship is, but just taking a step back and saying, okay, what are my relationships like? How am I investing in that dyadic interaction, the quality time with another person? And so if it's a small step, maybe that's saying, okay, I'm going to put my phone away for 5 minutes when I first get home from work to reconnect with the people who are there. Or I'm going to make sure, I turn my phone to silent for this time while I'm sitting with my infant, so that I'm not distracted or pulled away by the little notifications. And just how can we really invest in those dyadic relationships? We're social creatures and we need that connection. That's how we learn. That's how we connect and feel belonging and all of those things. And so when we are using our devices, how are they feeding that instead of interfering with that? And where can we sort of put them away and make sure we're protecting space for not undistracted interaction with others? And if we're in an isolated setting, where can these become tools to bring us, that connection and community as well?
Yeah, so well said, Kate. It's a tool, right? And yeah, both so empowering. And Monica, you talked a lot about redesigning the environment. And Kate, you did for connection, right? But intention too, like attention and connection. We're all having to be architects as we sort of redesign our lives for the values that we want, whether it's at work, at the organizational level, at home, in the health systems level. And it's really about small steps. A lot of us on the call are behaviorists. We know it's these tiny tiny little steps, the first 30, the last 30 minutes of the day, so what are those little steps? I'm going to give a plug for a step. The book that I'm working on is a weekly reader, and it's really about how to like make this actionable and a practice in your everyday life. And one of them in the book is to do what I call release the grip. So instead of grabbing for your phone, we're all habitually grabbing for our phones. There are technology companies now that are creating transitionary objects that you can hold a fake phone in your pocket. So it feels like you have a phone in your pocket, but it's not actually there. So releasing the grip is placing your hand on the top of your device with your palm open and saying, what do I need right now? Not what do I want? Maybe I want to scroll Instagram, but what do I need? Do I need to go to the bathroom? Do I need to get up and move my body? A lot of us have email apnea. We're holding our breaths while we're checking our email. We think it's a threat, not a tool. And our bodies often know that we're overloaded. We have to go to the bathroom. Our eyes are tired before our minds care to admit it. And so it's really about pausing and just saying, what do I need right now? Oftentimes as a parent, I dialogue that out loud. I say to my kids, what do I need right now? I actually don't need to do anything on my phone. I need to step back. And again, it's not about being perfect. It's just about testing and trying and experiment. So thank you both so much for creating so much hope today. Please, folks and friends, spread childrenandscreens.org and Screen Sanity. It's in the chat. I'm going to now ask Christian there he is. Look at that. Thank you, Fred, for joining us. And what's in the Q&A for the audience?
Yeah, we've got a couple of really great questions, a few really great questions, actually not a couple, I suppose. First one, are there free digital literacy and internet safety trainings and downloads that you can recommend for parents that you like? Our community has an event coming up and I want to offer something that is free so that anyone can access. I know of the Google program, Be Internet Awesome, but not sure I want to go with big tech's take on digital safety. So I appreciated that sort of awareness there, and curious if there's anything you would recommend.
Well, go ahead if either of you want to plug anything from your communities. I'm always going to plug Center for Humane Technology. They have incredible resources, ample. You can find so many when it comes to AI, to screens, to different environments and communities to host the conversation. But Monica and Kate, in addition to Center for Humane Technology.
Yeah, I was just gonna say, I mean, obviously, I think both of our organizations have some great resources. We don't have any explicit curriculum developed per se, but on the Learn and Explore area of our website, you can find resources that are designed by topic or by age, and really get into that. So, and all of that is free and will be. So that can be a good place for parents to go learn a little bit more.
Yeah, we have on Screen Sanity's website, you'll find some as well. We do have a webinar that's a small cost that you can purchase. We also do our parent nights, which are also those bigger events, but there are other free resources on our website as well. So if you get there, but I second Center for Humane Technology has great resources as well.
Fantastic. And Jennifer has just dropped both links to Screen Sanity and Children and Screens back in the chat to make sure it's fresh. So check those out. Absolutely. Our next question, first of all, thank you for this webinar, they say. In terms of implementation, what are your suggestions for considering the different nuances in each community? Communities around this person are predominantly Latinx, which are very underrepresented in the literature, and there are cultural nuances such as family dynamic. Curious at any thoughts or perspectives there from anyone on the panel.
I'm happy to go ahead, Monica. Do you want to go? And then I'll jump in.
I was just going to say, I think, implementation, I think when you look at the nuances in each community, I think it is important. And that's something that, I know that different organizations look at, but I feel like when we talk about that, communities being underrepresented, you can really find at any level, just starting with those basic things that we talk about and starting that conversation. I'd be interested to know a little, I guess, I don't know, can they answer in a little more about,
it was an anonymous question,
okay.
So I don't want to call them out, but.
Yeah, I'll let you jump in, Kate.
Yeah, I was just going to jump in and acknowledge first that unfortunately, I do think research could do a lot better at really digging into differences culturally, regions of the world, just all kinds of differences and what that might mean for specific strategies and their success and even uptake among different communities. One thing I always like to lift up here, and this I think applies to the whole conversation we've had today, but is often missed, which is there is so much that we know about human development and the core needs of human development, and then also parenting and what works and doesn't work, from decades and decades and decades of research. And that research has gone a little bit more into some of the cultural and community-based differences. And so I think, my starting point here while we wait on the screen research to catch up, which it is, there are some great researchers that are really starting to dig into at least differences in exposure to different risks and what that might mean for related harms, so that families might know to maybe pay a little more attention to certain, or ask questions about certain types of experiences, specifically when it might be related to race or identity, and what youth might be experiencing related to discrimination and hate speech online. But I think we can look back to what do we know about what parenting, there are the research does show some differences in parenting styles, right, among different communities. And so that might inform as well how parenting around digital media might need to look a little bit different based on cultural norms around what, child autonomy and parenting guidance and adherence to rules and all of those things. And so I think that's a good place to look while we wait for the screen specific research to catch up.
And I also just add to that too, go to the communities, go to the Latinx community. I used to lead bilingual parent groups in the Marin area, and I can tell you that there are leaders in those communities who have great answers. They are psychologists, they are teachers, they are parents, and they are in and live and embody in those communities. Go to those people, partner with those people, collaborate with those people. They have beautiful insights and awareness. Lived experience is expertise in itself. So don't forget to rely on those folks. Yeah.
We've got another question, probably time for two more. This one is, I liked the mention of getting ahead of AI. What might that look like?
Oh, I'm going to start. Go see the AI doc. It's streaming now online. I think you can stream it on Prime. It might also be streaming on YouTube. You can access it also on the Center for Humane Technology website. So Christian or Jennifer, if you can put that in the chat, that would be fantastic. There's also a playbook on the Center for Humane Technology website that's really helpful about what you can do after you watch that movie as an individual, as an organization, as a community, as a researcher. Also, another plug to join the Digital Harm Reduction Committee at the American Psychological Association Division 46, because we're taking action on how to be involved in that right now. Go ahead.
And I'll just add, I think there's so much that we've learned from social media, right? And what is happening around designs and mental health impacts and business models that are encouraging certain types of design that might promote more around engagement and attention and bringing users online as much as possible and keeping them online as long as possible, even if the designers knew that was not in their best well-being interest. And so I think what getting ahead of AI looks like is not waiting a decade or 2 decades to say we're starting to see harms. How do we go back and make sure that platforms that youth are using, or that may even be intentionally put in front of youth in school systems, for example, how do we make sure that they're being designed intentionally with awareness to children's needs and developmental capabilities, and building in very specific guardrails and safety designs that are privacy first, safety first, and are able to modulate by their developmental age, right? I don't want to assume that every 5-year-old should be experiencing the same thing as a 16-year-old, but really sort of demanding more of the tech developers themselves. And that's transparency, that's bringing child experts in to advise on their designs, and then actually taking those recommendations and implementing them and making sure that those changes are working. And I think a lot of what we're starting to see in the social media space, we should ask for, I would say at the beginning, but we're past that, but as soon as possible in the AI space as well.
I'll just add to that. I feel like a lot of times, even just getting ahead of it means people understanding where it all is. I talk to kids all the time that don't understand these ways that they're even interacting with AI on a regular basis. So I think making sure the education piece, first and foremost, is like not what do we do about it, but where is it already interact? Algorithms and what does that look like, and why am I seeing what I'm seeing, and how AI plays into that. I had a pediatrician tell me the other day, just a real quick quote that I thought made me really stop and think, was he said something like, what social media did to, self-esteem, I think AI is going to do to cognitive ability. And, I just think about that in itself. And so, understanding all the ways that it is, in all the facets we see it interacting in our lives and in our kids' lives specifically, that kids really don't understand that. So making sure that that education piece is really there, and they understand where it is.
Thank you.
If I can just add one more point to that, which I think is, another way to look at getting ahead of it is not jumping into the deep end, right? Like I think we all know there's so much we don't know about AI, and the sort of, it's here and we have to figure out how to use it, and children have to figure out how to use it, is, maybe not their best approach, and where can we maybe deploy some precautionary principles. We've talked here about anticipatory guidance and all of the importance of that in education, right? But can we approach these things a little, both from the design level, but even from how we implement them in our homes and in our schools with a little bit more precautionary, slow. We've taught you, Monica, you've talked so many good examples about basics, built small stepping stones that are based on, what's happening, and doing similar work with AI.
Fantastic. Thank you, everyone. For the sake of time, I do have to wrap up, though there are more questions coming in. And so with that, I will just say, make sure to check out our panelists' websites, their information. If you do want to follow up with a question, I'm sure they will field emails or through their contact forms or what have you. These are also, what I found so lovely was that these are the kinds of questions that I know Thekla and her committee are asking in the Digital Harm Reduction Committee. So check out the committee, join the committee if you're interested. So volunteer with the committee. There's a lot of really, I think, wonderful discussion and research and work happening in this space. So thank you again to Thekla, Monica, and Kate for joining us. Thank you to everyone who joined us today for the event. Again, a recording will be provided and posted to our YouTube channel. So please do check that out when you have the chance. Besides that, we do have some upcoming events open for registration. So if you haven't registered yet, check out, again, there's likely to be a link in the slide, but also this QR code on screen, which includes The Problem with Pretty, Media, Beauty, and the Psychology of Perception, with Dr. Allison Powell-Hicks, who is a brilliant psychologist and member of our division overall. So again, be sure to subscribe to our channel. Be sure to sort of check out our division. Join the division if you haven't yet, to be notified of this recording that is here. Thank you again. We hope to see you at the next webinar. Take care, everybody, and stay screen safe.